Our topic is on pulmonary stenosis, and I'm Kayla, and this is Shauna with me. And we're just going to kind of go through what it is and how it affects people and some medications and things.
Okay, so what is pulmonary stenosis? It's a condition that's caused by obstruction of blood flow from the right ventricle to the pulmonary artery. This increased pressure can cause the right ventricle to become enlarged or encounter hypertrophy. The obstruction can be caused by stenosis of one or more points from the right ventricle to the pulmonary artery or in the pulmonary veins that are returning to the heart. And some different spots of stenosis can be in the valve itself, the artery, or vein.
And throughout this PowerPoint, we will kind of talk about how the stenosis occurs in each area of the heart. So this is just a picture of kind of the pulmonary stenosis itself. You can see that the two yellow circles are indicating the pulmonary artery and pulmonary veins. Again, we kind of said before it can happen in the valve or in the artery and vein. And then on the right side, you can see a normal valve that is going to open and close, and then a stenosis or a stenotic valve is going to obstruct the blood flow.
So how does a person get pulmonary stenosis? The cause is unknown, but it can be secondary to other diseases, such as mothers who have had rubella during pregnancy. Some people will have other heart defects along with pulmonary stenosis, and this can actually cause the stenosis to progress. There can be genetic disposition, and then premature babies are often seen with this as well.
Another disease that is also common is congestive heart failure. Once people have congestive heart failure, they're often likely to get pulmonary stenosis, and we'll talk about this a little bit later as well. There are a few different ways that this can affect the patient. Pressure in the right ventricle is much higher than normal in a normal heart, and it must work harder to pump the blood into the lungs. So over time can cause damage to the overworked heart muscle, and when it's regurgitant, it can cause right ventricular hypertrophy. It can also cause chest pain and exercise intolerance, or they can be asymptomatic. So most mild forms of pulmonary stenosis will most likely be asymptomatic, but when it's moderate to severe, then the patient may be intolerant to exercise, or they'll have shortness of breath.
So some characteristics of pulmonary stenosis. Many cases of pulmonary valve stenosis are mild and do not cause many symptoms like Kayla said in the last slide. But the problem is most often found in infants when a heart murmur is heard during a routine heart exam. However, when the valve narrowing is moderate to severe, that's when you can see some of these symptoms, such as abdominal distension, cyanosis, poor appetite, chest pain, fainting, fatigue, poor weight gain with infants, shortness of breath, and sudden death. Symptoms may get worse with exercise or activity as well.
The prevalence of pulmonary stenosis is rare. It's most rare when it is seen just by itself without any other congenital heart diseases or any other heart defects. Transposition of great arteries in neonatal patients. We found an article about this, and they looked at patients, which we'll talk about again later, but looked at patients who had transposition of great arteries, which is just when the two arteries are reversed in the heart. And 21% of those patients also had pulmonary stenosis. And again, it usually is accompanied with other heart defects.
So there are currently no current medications for pulmonary stenosis alone, but patients with congestive heart failure in conjunction with pulmonary stenosis may benefit from anti-congestive therapy. Patients with cyanosis due to large right and left shunt, they require definite surgical procedure due to the severity of it. Prostaglandins and beta blockers can be used. Prostaglandins act as smooth muscle relaxant only in the neonatal period for temporary use before surgery, and an example of this is alprostadil. Beta blockers may also be used to reduce hypercontractility of the right ventricle following balloon pulmonary valvuloplasty, and an example of this is atenolol. And just note that alprostadil, the prostaglandin, it's only for temporary use to maintain openness before surgery for the neonates.
So again, like Shauna said, there's no medications that are going to fix pulmonary stenosis. Usually if it's mild, then the patient is going to live with it because they're asymptomatic and it doesn't affect them very much. And if it's more moderate to severe, that's when they're going to need surgery. So any medication isn't just going to fix this, but there are medications that will work on the heart before and after the surgery is completed.
So this just shows some of the tests that are used to diagnose pulmonary stenosis. Things such as cardiac catheterization, chest x-ray, ECGs, echocardiogram, MRI of the heart, and a healthcare provider may hear a heart murmur when listening to the heart using a stethoscope. So there are 3 different levels of pulmonary stenosis. You have mild, moderate, and severe, and there are 5 different types of pulmonary stenosis. These include valvular pulmonary stenosis, supravalvular pulmonary stenosis, subvalvular pulmonary stenosis, also known as infundibular, branch peripheral pulmonic stenosis, and pulmonary vein stenosis. So valvular pulmonary stenosis is when the valves themselves are thickened and or narrowed. Supravalvular stenosis, it's when the pulmonary artery just above the pulmonary valve is narrowed. Subvalvular is when the muscle under the valve area is thickened, which narrows the outflow. And then branch peripheral pulmonic stenosis is when the right or left pulmonary artery is narrowed, or both may be narrowed. And then for the last one, pulmonary vein stenosis. It's a progressive lumen size reduction of one or more pulmonary veins that can increase lung capillary pressure that can lead to shortness of breath and coughing.
So it's really important when you're evaluating your patients, or as a PT when you're just seeing your patients on a regular basis. New signs and symptoms that present could be chest pain, shortness of breath, or an exercise intolerance. Mild pulmonary stenosis may not initially show any abnormal findings on an EKG just because they are asymptomatic, but as the disease progresses, or if it progresses, there may be an EKG finding showing hypertrophy of the right ventricle, indicating that the disease has progressed. And again, this can also be seen with congenital heart disease or heart failure as well.
So the diagnosis of pulmonary stenosis is usually first suspected because a physician detects a heart murmur. But then there are 4 listed things here that indicate future likelihood of pulmonary stenosis, and these include congestive heart failure, if a baby is born prematurely, atrial septal defects, and ventricular septal defects. So the prognosis. People with mild pulmonary stenosis rarely get worse. However, those with moderate to severe disease will get worse, and the outcome is often very good, though, when it's treated with surgery or balloon dilation.
So we're going to talk about the 2 studies that we found, and the first one is lung pathology in pediatric pulmonary vein stenosis. So I kind of already mentioned this one earlier, but they examined patients with pulmonary vein stenosis and retrieved lung specimens either through a biopsy, explant, or autopsy. And the patients were between 1 and 4 years old, and 52% of the patients also had congenital heart disease, and then 18% were premature babies. Most patients showed pulmonary artery and arterial changes, presumably secondary to elevated venous pressure. And then also, the majority of patients showed at least some histologic evidence of pulmonary venous hypertension. They also had groups that they put the patients in, and they were either in a group due to post-repair, significant congenital heart disease but no surgical repair, no significant heart disease, or premature birth and bronchopulmonary dysplasia without congenital heart disease. Most groups had hypertrophy of pulmonary arteries as well due to the disease. So they, along with their disease, or if they didn't have disease, the pulmonary stenosis still caused the hypertrophy of the arteries.
So for our second article, this study looked at the prevalence of stenosis and described the surgical treatment to prevent its onset. Transposition of the great arteries is the most frequently observed congenital defect in neonates, but the study concluded that supravalvular pulmonary stenosis post-operation had a prevalence of 20.9%. But the main point that they wanted to find out was how common was it for the patient to develop pulmonary stenosis after they were treated for transposition of the great arteries.
And these are our sources. The first two are the articles, and the others are just other sources we use. Thanks for listening.